All, this is Dr. Mubin Sayed from drbeen.com. Welcome to one more show. So hope you're doing well. How are things? So Christy is number one today. Algebra Bean, hello. DDS, hello. James Crooks, hello. Dr. Z, hello. Susan Pick, hello. And please remember, Dr. Z is here. We're going to have Dr. Z with us on our show on 30th, which I believe is on this Monday. So looking forward to talking with Dr. Z. Okay, so tell me, how are things? What's happening? Carol, Raj's mom is here. Hello. Rima is here. Hello. Pat Day is here. Very good. Andrew says, new about molnupiravir? Not yet. I have not yet read. So there may be something new which I missed. Pasi says, good, Mr. The Show. Hope all is well with you. All is well. There are some folks who are on a campaign to get this site shut down and me stop from speaking. And so there is just that is happening in the background. We'll see. All right. So there's a question from Gold Country. Please talk about antibody testing and which test will be best to prove previous infection. So of course, antibody test, I do not know exactly by brand which one may be better, but antibody test, IgG test are the ones that are available. Although this is also interesting that in some folks, those antibodies are not, in many antibodies are not continuously elevated for a long period of time, which is natural. So then T-Detect FDA has approved, and that is a good test as well. Christy Tucker says, oh no, Dr. Bean, why? I think, so this is just my conjecture. What I think is that here, both folks become upset. Sometimes anti-vaxxers become upset, and I'm not using this as a derogatory term, and sometimes pro-vaxxers become upset. Sometimes they believe that if I am saying something and they think I should have said it differently, they want it to be changed. So if that does not happen, then many people just say, you know what, so be it. If they don't like it, they move on. There are some folks who they just have a lot of pain in them, and so they go on and try to do as much damage as they can. So there are some folks who are trying to do the damage, and I understand that they would like to do it, and I am feeling it that they are trying it. But I think these talks, these discussions are important to have. The question now is going to be that can I continue to have these chit chats or not? Because over here there is a direct talk back and forth, and is that something that is not good to do, allowed to do, let's say? So we'll see. So Jana says, I pray for you daily. Thank you. I love how you stayed true to your beliefs and really hope you continue. Thank you very much. For me, look, I was already fine as well doing other things. I thought this is an important time. We should have done this. We should have stuck together and do it. And then there are people who, it is difficult to accept for me that there are folks who would want to deliberately damage someone, but there are folks who would like to do that. And my friends have been calling me, my teachers have been calling me, there are other authorities. There was a what was that? There was an audit before, then there were death threats. Now there are reports, um, false reports. But still, when the audit happened, it took 6 months and a lot of back and forth and lots of time and money and lots of wasted resources. So that is happening now as well. But we'll see. We'll see if I can continue to have these chit chats or they do not make sense. We'll go from there. Okay. I still feel in my heart of heart, I feel something good. And that is, even if they now become successful in taking down everything, sending me to jail and whatever, I have served for 18 months and we went through the most horrible and dark times together. I think we had this journey, we stayed safe during this time. And so here we are. I think the remaining journey is actually lesser and smaller. So you probably would not even feel if I'm not there. But we have gone through a major time when we all did not know what just happened, the SARS-CoV-2, and how to navigate that, how to feel about it, how to think about it, how to understand it, how to behave with it. So I think that is done. So now even if they shoot me, that is done. So I think there is a good outcome so far. Rest we'll see. Doug says, I'll miss you, Dr. Mean. Thank you very much. I'll miss you too. All right. So Rima says, love you. Love you back as well. Moorhouse says, who is they? So Moorhouse, what happens is that when these complaints are filed, normally those are not disclosed at who did it. But usually the communication arrives with this at somebody complained about you and here is what we would like to investigate about you. So that is how it works. So we'll see. This is very heartwarming. Thank you very much. Soma says, we are with you, Dr. Bean, because you were with us in times of fear and turmoil. I am, so they say that at one age, the person becomes self-actualized, that there is a time that they need love and they need shelter and then they need money and then they need, other such leadership, power. And then there comes a time when if you drag all of those things out of their, system, even then they just keep being themselves. So this time has really helped me be myself. And thank you very much for everybody who's here. I hope that this is clear. I have never done it and I would not do it. I've never given an advice here. I've always tried to stay away from advice. And if there is somebody who's really desperate, I usually say, I can't give you an advice. I can only talk about how I did or my family did or my patients. Secondly, I've always been very clear that I do not practice here, so I cannot help. Still, when a cycle starts, when the files and complaints start, then they have their due processes and due stresses and due journeys and costs and effects. So we'll see. Leon says, thanks for your heart, your time, and your passion. Thank you very much. And Luffy, of course. That's Jana, that is a very interesting thing, that you have antibodies and you get IVIG infusion, and nowadays you're getting some reactions and they may have IgG plus. Very interesting. Very interesting. Hope that you recover, fast and completely and are all good in health. Rima says, what can we do to help? Rima, I think Nothing. If I had to, let's say, stop the chit chats, then I hope that folks understand that here, that it was not just a decision on my end, it was probably forced. And if I stop the whole channel altogether, that would probably be a forced outcome as well. But if it does not come to that, of course, at this time, there are lawyers and there are fees, and that there is that process that is happening. But we'll see. I still feel that a majority of the dark time is behind us. And so there may be the need is actually lesser. So it won't hurt that much. Sir Sursum Korda says, you seem are so calm about it. Please keep chat going for us. I will try my best. So as I'm saying, it's not something that will have been my decision, my personal decision. It would have to be um, somebody twisting my arm to say stop it. If that is the case, and that is the case, it is unfortunate that there are folks who are working actively to try to do that. I wish that they sometimes look in their own self to see how good they feel about it. Okay, so let's continue. Mary says, you were the voice that kept me calm in the early pandemic. I learned so much from you and came to appreciate you as a voice of reason, common sense, compassion, valuable expertise. Thank you very much. And this is when I was discussing the current situations which are going on for some days. Um, the important thing for me is I am a teacher. I am you. I think sitting the whole day long to draw 50 years of age to draw to present like cartoons, that takes love. So I'm a teacher, that is just who I am. So if the arm twisting is to the point to say you cannot teach, then I would have to go somewhere else to continue to teach. So I would not stop teaching. We'll see how it unfolds. uh, well played says, we appreciate you, Dr. Bean, thank you very much. um, So Luis Grande says, Lufimectin getting harder to get filled at the pharmacy. Yes, so I went to pharmacy. My doctor wrote me the with Rima, credit to her, um, and pharmacy refused it. They said we don't have it. They didn't even get into why do you have the diagnosis and what is the diagnosis and why do you need it and all that. They simply said we don't have it. If then they said if you want us to shift this to some other pharmacy, we can do it. We don't have it. So that's a very easy way for them to get out of it. Uh, Jody says, would you move on to Odyssey? So this is not about YouTube anymore. It is about me. The complaints are not about the YouTube channel, they are about me. So I will have to figure out how do I move forward. Jenna, it's not about the platform. Folks have reached, they know where I live because I very often talk about it. So they know where I live, and so they are here. So it's a different situation. It's more physical situation now compared to the platforms. ET says this is interesting. ET says had to go to local compounding pharmacy to get IVM. That's interesting. Jana says come to Florida. Okay, perfect. I will come over. I may have to. Carol says nothing wrong with you. Thank you very much. But the thing is this, that our so I'll tell you one thing, and that is, I was very young when I started working to get to progress, to advance in my life, to study more, to educate more. I was not going to be educated or study or, or becoming a doctor. And so somebody in I was in a more poor system and structure at that time. So somebody who looked at my ambition, they said, how do you think that you would actually be able to do this? You'll become a doctor, or you'll. And I said, look, either I'll keep working on it. So either I'll get it or I'll die working on it. So it's the same thing. I'm a teacher. I will continue to do this. And if I have to go and do it somewhere else, then I'll go and do it somewhere else. Absolutely. Absolutely. So all good. We are fine. Wendy Lowe says insurance paid for my. Very nice. I like it. Amy says move to Florida. Perfect. Jana says I have spare room for your wife too, but my 14-year-old dog doesn't like the cats. Yeah. Thank you very much. Thank you. So you might have noticed that I'm avoiding some questions. So please don't think that I'm avoiding you. So Roman says, I am hoping this will help with a bit with your bills. You give us all some sense of hope and calmness in these still uncertain times. Thank you does not stay enough. And thank you doesn't say enough. And I'm working again. They're squeezing Luffy. Good. Congratulations that you're back. Thank you very much for this as well. And very good that you are working. So Stephanie says, previous EDRN, I have learned a lot from you and want to thank you for keeping to your integrity and teaching real science. I'll keep you and your family in my prayers. Thank you very much. The Blue Velvet River. Have you gone to flccc.net and seen their website? Maybe there is something there you can find. I'm trying to. Somebody is saying there's a super chat question. I'm trying to see which one. In general, is the J&J vaccine safer for a 60-year-old male with multiple cardiac issues? I don't hear much for the cardiac side effects compared to medicine. So again, not talking about you, not talking about a specific patient, looking at the vaccine trial data, almost all vaccine above 60 years of age are fine. So J&J, I have not read any data that said J&J above 60 may have a problem, including cardiac or other issues. So amazing. Philippines says, thank you for all those discussions. Dr. Bean, I'm sure I had the Delta a couple of weeks ago, fever and slept for about a week. As a healthy senior, I feel low risk and I also take ivermectin. Very interesting. Congratulations. Do I hear a duck quacking in the distance? Good one, art patron. This is an interesting question. Skipping the second mRNA dose and majority of adverse effects. How much lower is the long-term protection away from the short-term antibody-driven defense memory cells? So the studies, I can only talk about the studies. I cannot know how it works for individuals. Studies are less for Moderna. UK is the one where there is a distance which is elongated between the two doses, and there are less studies from UK about them. Non-Moderna studies, for example, AstraZeneca and Pfizer. Pfizer is mRNA, I believe, as well. In there, they saw that the vaccine efficacy single dose continues to increase even up to 84 days and reaches 80-84%, if I'm recalling correctly. And then the second dose brings it above 90. That is what I remember for Pfizer and AstraZeneca. What I don't remember is for J&J. I think J&J's efficacy is generally lower and continues to grow upwards, but lower. I think, and I may be wrong here, my thinking is, my opinion is, and not for, for any single person, generally from an educational point of view, that with the delta being faster and rapid, it may be important to not have a very long distance, but I don't have data about that. I have to look at the studies. Bill Nicole says, do you know anything about the menstrual cycles being affected by the vaccines? Have they looked into that? Yes. So I have done a talk in the past about the vaccines and the cytokine release, and that may cause menstrual cycle disturbances, which usually subside after 2 or 3 times. So I am not available. I haven't seen any latest. Wendy Richardson, thank you very much. Doug Paz says, we have appreciated you, Dr. Bean. Thank you very much. Thank you. Doug says, your mouse sounds like a tiny duck when you scroll. Yeah, so I see. So let me do this. I scroll this. This is a, so one of the, the folks who are trying to cancel things, one of the outcomes have been that I have a numbness here in this area. Although there is a cool bean doctor, Andy Butler, she has helped me a lot, and this has reduced. It used to be bigger, but now it is in this place. So I have been using this mouse. It is a vertical mouse. The only problem is that it makes this click sound, and when you when you work with the wheel, it creates that sound, the duck sound. Jana is saying, where is your wrist cover? So my wrist cover is here. I usually wear it when I'm drawing. So today I'm not drawing much, so the cover is sitting on a side. I used to be wearing that hand splint to help me with the, there was a time when this was very, very painful. So that is not there anymore. So there's no pain. So I'm fine there. That's why I don't wear that. I just now have a reminder, I think, for the rest of my life that there was a pandemic and I was I was doing a lot of drawing. Joy DC says, regarding boosters, how long do you think it would take for antibody levels to return to levels seen after dose 2? A few days like with national infection, or 1 to 2 weeks like after dose 2? Ideally, from a mechanism point of view, the antibody levels should get up to speed a couple of weeks, and then they should continue to go on for 3-4 months. However, let me now counter my point. The study that we just saw, I'm going to share it, it's still here. The study that I just shared with us, this study has an interesting point in it. That is this. I don't know if some of you caught it or not. That point is this: vaccine given here, then they started observing 7 to 8 weeks after, and then infections occurred. So that means even that active immune system, vaccine given here, second dose, let's say about 2 weeks later, there is enough antibodies now, they were here, enough antibodies, and they should have continued for 3-4 months and then decline. And at least for this 3-4 months, there should be better protection. But interestingly, they started seeing the reinfection in 7 to 8 after 7 to 8 weeks. The question mark, big question mark, is the following: out of how many vaccinated did they find these 65? That is what I do not know. Meaning, was there, let's say, 10,000 vaccinated? Out of those 10,000, they found 65 who were infected. That's fine. That's not a bad ratio. But if it was that, hey, there were total 100 vaccinated and 65 got infected, then there's a problem. So that is the data not present, but this was an interesting thing for me to look at. So to answer your question, it is possible that the antibodies are waning faster. I haven't seen any latest study. Ideally, the antibodies should continue at least for 90 days at a higher level. So Palam Pura says, ignore all those who are upset. It's a problem if they're turning to do the damage, they're just sick and need help. That is correct. The thing, Palam Pura, is that there is some kind of damage that I cannot, for example, if I do not respond, they have done some things that I am compelled, I am mandated to respond. And if I don't respond, then I will have further problems. So this is, I just have to go through this. And this is, I don't have any, I understand this is life. And I understand that in this life, there are all kinds of people. There are people who decide to serve and save, and there are people who decide to hurt and cause damage. And they all have rationale. So if you ask somebody who hurt somebody or harmed someone and say, why did you do it? They would have a reason. They'll say, I did it for following reason. So as long as somebody can mentally justify something, they can go to whatever length they want to. And what I've seen is sometimes people want to do something. Let's say they are angry or they are egotistic, or then they would find justification to do it. That's just, as a human being, that's just their issue to figure it out. In that process, they would hurt people, but that's how life is. Yuma says the system is working against you right now. Correct. And the thing is, it was pushed to start working against me, but it's okay. We'll go through this. Look, our world is going through a bigger problem, the pandemic itself. That is an issue. My issue is, compared to that, a smaller issue. Will Irish says, why not yet? Or how does a large study get coordinated for ivermectin? That seems to be the excuse. It's not endorsed. It defies logic with all the stimulus. We are praying for you, doctor. So thank you very much for the prayers. This is interesting. What I have seen is those studies that have used ivermectin, there is always some gap somewhere that can be pointed out, and so that is used. And then some folks who think they can do the study, they don't believe in, and I am with them, they don't believe in placebo or double blind like study at this time because it is an unethical. Reason being that there are vaccines available, there are solutions available, and to keep somebody away from those solutions that are available to say, I'm going to do a study, does not look right. But at the same time, there are pills that are being made by big pharma, and those pills are getting trialed as well. So I think it's not there yet. Liz, this is a very interesting question. Are we going to get boosters all of our lives? So you may have heard from me that I wish really that we don't end up with boosters. A few days ago, the studies that I mentioned, and I believe that the cycle that has started on me, it was because of one of the studies and the folks in there who were commenting. But anyways, um, you saw that studies a few days ago that I discussed. Those studies showed that within 4 or 5 months, the vaccine's efficacy reduces, or the way, I shouldn't say efficacy reduces, the antibodies wanes, and then there could be infection. And so they are thinking, I think that at that time there is a booster needed again. I don't believe that would be for everyone. I read some of the communications around boosters, and there were very specific instructions to say immunocompromised, people who have been given steroids, people who have leukemias, people who have cancers, people who have bone marrow transplants, organ transplants, and so on. So there was a group of folks who I could say that they would have their immune system may not be working as optimally, and they were categorized in the communication to say they should think about booster. I think that is fair, but saying general boosters, that is something we still have to, let's see how it unfolds. Yeah, so Moorhouse, you're correct. The communication that I had, if I can quickly open it, I do not know if I can. Give me a second. I'll hope not to waste your time. Sorry, I couldn't find it. But the communication that I got that had a number of clauses, and those clauses made sense. For example, somebody who's actively on high dose steroids, their immune system is not working as high, as optimally, as better as compared to a healthy person. So for them, if they have to get a booster, then they have to get a booster, and their booster actually would just bring it up, not to the peak, still may not be fully activated. This is interesting. So Jana said, Dr. Me, people are here getting boosters. They aren't high risk. Fully vaccinated includes the booster here for Pfizer and Moderna. So that's an interesting situation. At least the communication that I received here in California, that had those. Maybe after a few months, they'll say, you know what, now everyone. So folks are saying sorry to Pasi. Pasi, you doing okay? What happened? Rico USA, thank you very much. Thank you. Uh, hey, Kyrie. So this is not Luffy, this is Kyrie. Kyrie, how are you? Kyrie has a funny voice. Hey, Kyrie. So, Jana, is this is Florida, right? In getting booster, is that an option? You can just go in and say, "Hey, I want a booster." Is that what is happening? Hey, Kyrie, how are you? So this is Kyrie. I was holding her in an odd way. Mr. J says, "Is it wise to test D dimer levels after vaccination?" So again, not as advice or anything directed to a single person. From a educational point of view, it is interesting to do D dimers to see if there is inflammation. I would think that after vaccine, it is possible for some inflammation. It is if the symptoms continue, then tracking of the inflammation markers will be interesting. This is a very important question. Talk about tinnitus and Novavax. So I'll tell you the truth that still I haven't found the reason for tinnitus with the vaccines or with COVID. And because of that, I'm not able to, I understand the mechanisms of tinnitus. What causes it with the vaccine? Is it the monocytes and the congestion of the blood vascular system? Or is it something else? That is still not clear. I would do this. I'll look into some studies to see if I can provide a more informed opinion or not opinion, some studies that are useful. So far, I keep looking around and the message is we don't know yet why this happens. Hmm. Anonymous says, if you take immunosuppressive drugs like colchicine, is it okay to take immune boosting supplements like vitamin C? So, question is, what is the colchicine taken for, and how much of the vitamins? Generally, vitamins that are lesser, keeping them in the right quantity is a good thing, and that would be healthy in all cases. But boosting it extra is not recommended, and I think that is the case for all of us. Kyrie was cute. So I wanted to make sure that we do HH chat today. Oh wow, Christy says my tinnitus is getting worse. I'm sorry about that. I hope that you have talked with your doctor and you have talked about the various anti-inflammatory protocols. So let's do this. I just wanted to make sure that we do HH chat and we talk about what's going on. I have been absent for a few days as well. So we'll continue from Monday onwards. Thank you very much for all your love and care. If at some point it turned out that the chit chats have stopped, it may be. And that must be some arm twisting, but I'll try my best to continue. So with this, have a nice weekend, and I would see you on Monday. Bye bye.